Hi, my name is KHearn. I'm a nurse working on my Master's of Nursing Administration. I am taking a class in nursing healthcare and policy, and the assignment today is a mock interview with a potential politician to help with policy change. Good evening. My name is KHearn, and I understand that you are a Texas Senator. I appreciate you joining me this evening. I'd like to ask you a few questions. Would that be okay?
Of course.
Okay. So I'm thinking that with the American Care Act, the Affordable Care Act, that we need to make a few changes in it. And I was wondering if you would help support Senate Bill 717, which is insurance coverage for all clinical trials. Would that be something that you're interested in, or do you need more information?
Maybe some more information.
Okay, so what this is talking about is insurance equality for all patients that participate in clinical trials. That just means we're trying to get drugs approved by the FDA. They have to go through a trial process. Regular insurance covers them, Medicare covers them, but clinical trials are not always covered by private and employer insurances that were in effect before the American Healthcare Act. And the problem with that is that patients often go into remission and sometimes they fail or relapse, and there's no other treatment left for them except to go on a clinical trial, and they can't afford to do so if their insurance doesn't cover it. So we know that the cancer treatments are very expensive, and not all patients are going to choose to participate in a clinical trial because they don't have the insurance coverage. Some of these trials, if we were to put the drug on the market now, might cost the patient $10,000 to $20,000 a month. And so a clinical trial is one way to get a new experimental drug that probably has a good chance of being approved, and it's a much more reasonable cost. It's free, but the insurance won't cover the standard of care, the lab work, the blood work, CT scans, MRIs, that kind of thing. So what we're trying to do is get lawmakers to support an amendment to the American Affordable Care Act and allow those plans that are grandfathered in to start phasing in coverage, like maybe a percentage of the time. Like this year we cover 25% of it. The next year we cover 50% until they're all insurance plans are covering clinical trials. Would that be something as a legislature you would be able to support?
Yeah.
Well, I thank you for your time.